Hi, everybody. I'm Jean Chatsky. Welcome to Your Money Map. Very glad to have all of you along with me today for the ride. I remember the first time I realized something that, as Oprah likes to say, I now know for sure. And that's that health and money are inextricably linked. You can't have a financial life that is on steady ground unless your health is moving in the right direction. And the reverse is true as well. If you don't have good health, your finances are eventually going to feel the toll of that. And that's what we're talking about today. My guest is Nora Super. She is Senior Director of the Milken Institute for the Future of Aging. She is the Executive Director of the Milken Institute Alliance to Improve Dementia Care. And she lives in this intersection of financial wellness and health longevity. She works in data-driven research, meaningful policy initiatives, and impactful conversations in the United States, bringing about the sort of information and change that we all need to make these areas of our life work successfully. As always, I invite you to join our conversation. Please put your questions and your comments into the comment section. I will weave them into our conversation today. But before I do that, let me say a big welcome to Nora Super. Hi, Nora.
Hi, Jean. Great to be here with you. Thanks for having me.
Well, thank you so much for joining me. So, as we dive into this topic, tell me a little bit about your background and tell me about the work that you do at Milken.
Sure, happy to. I've been working on retirement and health issues throughout my career, over 30 years in the DC area. As I started out on Capitol Hill as a Capitol Hill rat, as my husband likes to call, but I really worked as at the Employee Benefit Research Institute early on in my career and got religion early about the importance of saving, but also the importance of health insurance, long-term care insurance, all those other protections of your finances in addition to retirement income. So I've been working on these issues for quite some time, and I had the honor and privilege to serve in the White House under President Obama as the executive director of the White House Conference on Aging, where again, we looked at the intersection of these issues. We looked at retirement security, healthy aging, long-term services and supports as key pillars. And now I'm at the Milken Institute, where the Center for the Future of Aging really looks at these issues. Our primary focus is financial wellness and healthy longevity. And last year, we launched the Alliance to Improve Dementia Care, which I hope we get a little time to talk about because, neurodegenerative diseases. The good news is that we're all living longer. The bad news is that puts us at greater risk for some of these diseases. And that's something that we also have to keep in mind as we're preparing and saving for our later years.
We absolutely will have plenty of time to talk about them, as well as solutions and tips for staving off the problems of dementia, but also how to recognize the signs if and when it hits. But before I get there, can you set the table for me? Where are we in terms of our financial wellness and healthy aging initiatives? And are we making progress?
Well, I think unfortunately COVID has set us back a little bit in terms of our financial wellness. We've never been a country that has done a lot of saving, and I think that that's something that we see over and over when we do surveys, and certainly because many people lost their jobs, or they had to work part time, or they had to step back. We found even before the COVID pandemic only half of US adults over age 50 had more than $100,000 saved, and nearly 30% had no retirement savings at all. And what we found that this has become, certainly impacted by COVID now because of unemployment, involuntary retirements that we're having, which just increases the risk of this widespread downward mobility. And of course, older adults were at greater risk for getting the virus in the first place, too. So the health risks are there, as you mentioned. So many people took on, it's not even just the health, which certainly impacts your ability to work, your ability to be productive, but you can rack up a lot of medical bills if you get sick and if you are in the hospital for a long period of time, which many people don't have the savings, as we noted, to pay.
In terms of your work, it's interesting to me that when you focus on healthy aging, you you are choosing to look at finances at the core of that. When we think of aging, I think many of us think of doctors and medical care and different parts of the body. Why go so fully focused into finances?
Well, as you noted, and as we've looked at a lot of research and seen how finances you have, not that money buys happiness, but certainly it makes your life more secure so that you're not as worried about paying your rent or your mortgage, having a home to live in, having resources to pay for services that you may need, and hopefully to be able to enjoy your retirement years where you can travel and that you're still physically well enough to be able to enjoy life when you're not working all the time. So having the finances to be able to do that is a critical part of people really realizing their dreams of what they want to do. We see some older people that become entrepreneurs or start whole new businesses, or we're living much longer, which is very exciting, but you have a lot more options if you have financial security.
If you are listening to this and you're feeling like, all right, I'm looking at retirement, it's a little ways down the road, I'm not quite as financially secure as I would like to be, what steps do you need to put on your roadmap?
Well, I'm an advisory board member for the Alliance for Lifetime Income, and we really stress that a deferred annuity is something that folks may want to discuss with a financial advisor and setting up. And what this just means is that you have a guaranteed income that's coming in. Right now, a lot of people get their lump sum from their 401k distribution and they spend it on something because they have a lot more money than they've had ever at one time. And while that can be tempting, as I mentioned, people are often living 20, 30 years after they retire, and it's hard to stretch that money out over that period of time. And what an annuity does is allow you to get a guaranteed amount of money that can help supplement your Social Security to be there. There, are also some tools that people can, if you work for an employer that offers a 401k or a 403b, just take the match. If there's a match, that's just a great return on your investment, and put in that much. Those of us who are over 50, we can save even more. And that's something that I've been doing since I turned 50 is, I didn't have as much disposable income when my kids were younger and when I was paying for their colleges. But now that I'm a little older, I'm putting away more money for me. And the great thing about some of these retirement plans is it just happens automatically. You don't see it. It doesn't come to you. So you don't have that temptation to save, but you do have to take that action to make those contributions and to look at some of the options that you have to a more secure retirement.
It's so interesting that you noted that you're putting away more money. I'm in my 50s as well. I'm putting away more money too. And I've looked at the research on our spending curve through our lifetime. We spend the most when we're in our late 40s, early 50s, when those kids are just heading into their college years. But then our spending does taper off as we enter retirement, and hopefully the kids leave home and maybe we can unload a car and maybe we can downsize. But as you get toward the end of your life cycle, healthcare expenses start to kick in big time, and our expenses start to seriously rise once again. When you talk about a deferred annuity, and I should have mentioned at the top of the show, but I'll mention it now that this broadcast is also sponsored by the Alliance for Lifetime Income. When you talk about a deferred annuity, are you talking about an annuity that you buy at retirement and then just turn on when you need the money in your 80s or mid 80s?
Well, there are different options, and I really encourage our listeners to go to the Alliance for Lifetime Income to look at some of those options, the website. There are also a calculator to have a sense of what you need, but there are different options that can provide that deferred amount. There's some life insurance options that will switch over to an annuity. So again, as you said, no longer life insurance might not be as important if your kids are grown, but having that income to last so you don't outlive your assets is really important. So there's some products that allow you to switch over. There are others that you can take a portion of your retirement savings and make it a deferred annuity, so you don't have to take all of it. Some people really like to have more liquidity and ability to have access to some of their money. But then, just really look at some of the options on the website for the Alliance for Lifetime Income, or talk to a financial advisor. There are a lot of tools now, a lot of things making it easier for people, where they'll just calculate for you and give you, sort of like the Social Security Administration does, showing you what your benefit will be. Can calculate, if you save X, then this will likely be what your payout would be. If you save Y, it will be this. And people can choose, different people have different needs and what they think for their monthly income.
Yeah, absolutely. Mark was asking a question about the sort of return you can expect from these vehicles. And the answer, Mark, is that it's all over the map. It really depends on what age you buy. It depends on how much you contribute. It depends on how long you let the money sit before you start to turn it on. And it depends on the parameters of that particular vehicle. But like Nora suggested, if you go to protectedincome.org, that is the website of the Alliance, and you'll be able to find a lot of information. Thanks, though, for the question. We love it when people who are watching participate. Nora, when we're looking at our needs toward the end of life, we get into the topic of long-term care. And I know that you just released a report about long-term care options for middle-income individuals. This is fascinating to me because often we think there just aren't any, but you found three good ones, 3.5 good ones, if I read the report correctly. Can you talk about the whole idea of long-term care and funding it?
Sure. Long-term care generally refers to assistance with activities of daily living, and what people in the field call ADLs. And what this means is, people need help with things such as bathing, cooking, dressing, depending on what type of physical or mental challenges that you may have as you get older. And what this does is, long-term care insurance helps generally as a cash benefit, which will give you a certain amount of money that will help you pay for these services. So whether it be housekeeping, or someone to do your yard, or someone to assist with these activities. And unfortunately, long-term care insurance has, the number of insurers offering it has really restricted in the past few years. We've gone from over 100 to only a dozen still in the market today. And that's because it hasn't been a great, the insurers have been losing money many times because it's hard to predict how long someone will live with Alzheimer's disease or dementia that is growing in terms of the number of people that have that. But also, as you mentioned, and then in the federal government tried to put in the Class Act back in as part of the Affordable Care Act and had to repeal it because it wasn't financially sustainable. So many people throw up their hands and say there's nothing we can do, especially for middle income households, as you mentioned. In our country, we have a safety net program, Medicaid, that helps provide these long-term supportive services to really low-income people. But and then wealthy people can self-insure. They generally have the savings that they can do this for themselves. But those in the middle really don't. And these costs can be enormous in the U.S. The cost of a nursing home can be over $100,000 for a year for people that get in there, and most people don't have that kind of savings, as we found. We did a series of what we call financial innovation labs at the Milken Institute. We did a number of interviews with experts and asked, what can we do for these folks? And as you mentioned, and you can find the report on our website at the Milken Institute, if you just put in the search engine long-term care, we have a tremendous amount of information on that, but really looking at ways that Medicare might offer some supplemental benefits that people can choose as a Medicare Advantage plan to have some of these supportive services. That distinction between medical care and long-term care has become less clear now, as we see, and the pandemic really brought this home. Often getting people food is more important than getting them access to a doctor. They really need the nutrition to be healthy, for example. And another option is looking at some of the integrated plans that we've had for some of the low-income populations, special needs plans, PACE programs, and adapting those so people with more income can buy into them and take advantage of these integrated services that, again, combine the medical with the long-term care. One misconception, unfortunately, that many people have is that Medicare covers these services, and they don't really realize until they need the services that they should have saved or bought a product. So we also looked at new long-term care insurance products, public and private sector options. Some states are really putting their toe out. Washington State has a program. California is contemplating a program. The states are looking at these solutions because they're on the hook to pay for Medicaid as well. So, there are some promising solutions, and we've been trying to promote this to really get policymakers and consumers, constituents, to demand of your policymakers that this is something that really needs to be addressed.
Yeah, we've got people asking for the link to that report. Could you just give the website one more time?
Sure. It's just milkeninstitute.org. And if there's a search button there, if you go there and type in long-term care, you'll see the wealth of information. We have charts, we have the reports, we have a lot of background information on the past, present, and future for long-term care.
I think one of the other fallacies about long-term care is that you have to cover for it fully. That it's no good unless you buy a policy that's going to pay for every last bit. And I've come to think of it as more like a Medigap policy, where if you can pay for just a slice of it, you can cover some of the money that you need out of your savings and out of your retirement, but it'll just make life easier. Does that skew with the solutions that you have come up with?
Absolutely. We believe, every little bit helps. And we certainly, what it is, it's usually these are cash benefits, as I mentioned. They give the control to the consumer to choose. You may choose that putting a ramp up at your house is what you need the most. I may choose to have someone come into my house to help cook dinner at night. And I can use that benefit in the best way that we can. A lot of times people will have folks come in for a short period of time, but there are a lot, you can just situate your home in a way so it's easier for you, so you can have grab bars in your bathrooms and other things that keep you safe and healthy. You mentioned, Jean, like there being healthy is really important to how long and how your healthy longevity towards the end of life. And there's some small things people can do to protect themselves from falls, which is one of the highest rates of disability for older adults.
Mhm.
Things that you can do to, to decrease your risk for dementia, decrease your risk for heart conditions, diabetes, etc. That these types of things can really help not only with the cost of healthcare, but also really help you enjoy your later years longer. And hopefully, you'll just need some supplemental income to pay for that. But again, as I said, most of these models really do leave it up to the consumer to use the benefit as they see fit.
Yeah, 100% I agree with you. I wrote a book a while back called Age Proof. Wrote it with a doctor named Michael Roizen of the Cleveland Clinic. And he just laid out the fact for me that if you can get yourself to eat healthy, avoiding trans fats and saturated fats, to get up and move, to bring down your stress level, you are going to go a very, very long way to staying healthy and reducing your out of pocket healthcare costs as you get to the end of your life. It makes a huge difference.
Absolutely.
Brain health is also incredibly important. As you're looking at this, tell us a little bit more about the work that you're doing in the study of dementia, and in particular how it relates to financial wellness.
Absolutely. So, I often tell people the reason why I work in the aging field. I've experienced both ends where my mom died when she was 51. She had breast cancer. And so through that experience, I learned life is short. You got to live each moment. You never know when it's going to end. On the other hand, my father had Alzheimer's disease, and he was sick for 6 years. We went in and out of the medical care system, the long-term care system, and really, what I think, unfortunately, because age is the greatest risk factor for Alzheimer's disease and dementia, we're seeing growing numbers of people get dementia. And the cost of that, as I mentioned, can just be so overwhelming for people, whether, a nursing home cost can be up to $200,000 a year as much. Assisted living is also can be several $1,000s a month. Even having someone come into your home to help. And what we're finding is many caregivers are working full time. They can't take the time off to be home with their spouse or their moms or dads. And so they need to pay out of pocket for other people to come assist them with this, which all of those things cost money, in addition to the medical expenses, which do really impact people as we're working as our Alliance to Improve Dementia Care. So we launched this in July 2020, really based on a group of over 60 organizations, experts in the field, from academia, from businesses. We have people living with dementia and their caregivers. That's really important to us. We have organizations from community-based organizations that are there, and really try to have this wide frame of how we look. We have government partners who are working on this. Alzheimer's disease is the most expensive disease in the US, and that's already true. And we project that it will just grow in expense because the number of people that will get Alzheimer's and dementia is going to increase simply because we're aging. And so that's one thing that we have to look at. And as I mentioned, many people, the last thing they want to do is go into a nursing home. And, unfortunately, we saw with COVID that it also increased our risk for communicative diseases. So I think people are even less likely to want to go into a nursing home than they were before COVID. But some of the alternatives, staying at home, that can also be expensive, trying to find the supports and services that people need. So that's, again, why I think financial wellness and health really go together, because, having that access to those financial resources can help provide those supportive services to not only help the individual living with dementia, but their family members that are, helping to care for them.
I flipped on the Today Show yesterday morning and caught Al Roker saying that some new researcher thinks that they've solved for aging, and every time I hear that, I just think, oh no, oh no, please don't. We're not ready for that yet. When we look at aging, when we look at the signs of aging, one of the first things that tends to indicate that there might potentially be a problem is a slippage where you're managing your finances. What do we tend to see? How do we notice what the signs are?
Yeah, that's a great point. Money management is often one of the first signs that people see, and with financial advisors, some banks like Bank of America has really been training their advisors to pick up on some of these signs. That there are resources to make sure that people don't transfer a lot of money that they don't really want to do. So big transactions, the high spending, low spending if you're normally a high spender. Just changing in the way that you manage money is a sign, certainly, of dementia. And the Alzheimer's Association has great resources on their website that really talk about the differences between normal aging and Alzheimer's disease. And, people will often see some memory impairment and say, well, I'm just getting old. And there are, many parts of Alzheimer's disease that really are not a normal part of aging. And, there's a big difference. And you can look at, they have the top 10 signs that you can look at and ways that you can help, yourself or someone that you're worried about to check that out. There are cognitive assessments that people can take, and they can only take 5 minutes and just give you a sense of your cognitive status. One of the things we're advocates of at the Alliance is that people really should check their brain health on an annual basis, just like you get your preventive screenings for breast cancer or colon cancer. You can see it's important to have that baseline to see if it's changed at all, so that your physician or your family can say, this is different. Some things are happening, and it's not just memory. Interestingly, women tend to have better verbal skills than men, so they can often mask dementia for longer than men because they can think of the words to say or be able to articulate that. And so some of the tests that they've done haven't been as accurate for women. So they're, working on all of these things, but it is important. And the other thing I want to stress, Jean, is that there are things you can do to improve your brain health, no matter what age. Just as you were mentioning, the importance of exercise and eating well, which are all important for all disease. And people ask me all the time, well, what can I do to ward off getting dementia? And again, just move. I mean, the one thing that we know for sure is exercise is good for you, and it really helps with cognition as well as your physical fitness. The other things, that there's a Lancet Commission report that really looks at, recently came out with 12 modifiable risk factors that we can do to improve our brain health or reduce our risk for dementia. They've increased this over 9 that they had done in 2018. And all of these things, they're lifestyle factors, but I've seen in the work that I do, I work with a lot of people living with dementia and hear, that people talk about doing things like exercising or eating right, even after being diagnosed with dementia. People live longer, better lives because their cognition is better. Their ability to walk around. Hypertension is a huge risk factor
Mhm.
for dementia, as it is for, of course, heart conditions. So getting your blood pressure checked can be one of the most important things that you do for your brain health. Just to know, there are medications you can take. You can also do things with your diet and exercise that can reduce that hypertension, which, and then when you hear the first told stories that people say, not only does it help with the dementia, but they feel a lot better. When you
Yeah.
start trying to take care of yourself, people feel better and they enjoy life more.
How about the multiple games of words with friends that I have going on my phone at all times? Does that help?
Does the multiple games?
The words, the word games that you play on your phones. I mean, is that just an urban
Yeah,
legend
well,
that
I mean,
they
there
have?
are some evidence. So ARP, which is part of our steering committee at the Alliance to Improve Dementia Care, and they have the Global Council on Brain Health, where they've done first-rate scientific studies, but they translate it into consumer knowledge about sort of what do we know about these different things, whether it's alcohol consumption or word games. They have a whole campaign called Staying Sharp, and what you'll find is it depends. There are people selling things that really don't help, and so you have to be careful, that you don't get sucked into certain things that might not be that beneficial. But we do know just using your brain helps. So learning a new language, and most of us aren't going to become fluent in our 50s, but you're using a different part of your brain to think about that different language, and taking up cooking, some new hobby that is making you think in a different way, is really important. And sure, those word games, the crossword puzzles and chess and things where you're really using your mind, bridge, where you're trying to remember things, those all can be beneficial to your brain health.
You brought up the topic of women earlier, and I wanted to talk a little bit more in depth about both women and minorities and how they're impacted when it comes to financial wellness and healthy aging.
Yeah, it's a great point. We just released a report actually that looked at ways that we could build health equity for. We look specifically at Latinos and African Americans because that's where we can find the most data on the impact of dementia. But even there, we've just begun really studying them. It wasn't that long ago that the National Institutes of Health didn't even have women in their studies. Now, 50%, more than 50% of people in Alzheimer's studies are women, but we still really need to recruit more people of color to these studies to learn more about what risk factors are different, what people can do. But what we do know is that African Americans, they have a double the risk of whites in getting Alzheimer's disease, and I think it might even be triple. I might double check that because I know Hispanics, it's as high as quadruple. And and some of this has to do with some of the socioeconomic factors that impact people's health and financial wellness, as we talked about, really impact how well you're going to age. And really, I was looking at some life expectancy numbers before we got on the phone, and we see that even today, we know, like in 2030, just 9 years away, more than 70 million people are going to be over age 65. That's twice the number of people in 2000. So it doubled in 30 years. But the research is showing that there's a huge gap between the rich and the poor in the United States. And the richest Americans live 15 years longer than the poorest. And for women, the gap is 10 years. So again, there's this really strong connection between your financial security and your health. And we need to better understand these reasons through research, but it's also opening up opportunity. I think our country is becoming much more aware of systemic racism and how that's impacted people's ability to save, to people to have earned income, create wealth in terms of having housing equity, savings options, all of those things that contribute to that. And, as a woman, that I get really passionate because it's 2/3 of women that have Alzheimer's disease. Women are more impacted by it, not just because they're more likely to get Alzheimer's, but because they're also the caregivers of people. So it's, the wife taking care of the husband, or the daughter taking care of mom or dad. And if it's the mother-in-law and the father-in-law, it's usually the daughter-in-law and
Yeah.
not the husband. And so, and then what happens is, people will make financial decisions where in our society, men have typically earned more. And so we'll say, well, it makes more sense for you to drop out of the workforce. And then that just has a cumulative impact over time where, women don't have the savings when they retire. They don't have the wealth. They haven't earned the income. They don't even get the Social Security credits,
Yeah. No, I know. I mean, we've talked about this on this show before, and I think it's really important when you're weighing the decision about taking a step back from the workforce to look deeper than the comparison between your current salary and the amount of money that you're paying for care. Andy asked, and I think it's a great question, what can be done for caregivers to support the financial burden being placed on them when they step out of the workforce to care for older parents with dementia or other chronic conditions?
Well, it's a great question. And, even today, maybe as we speak, it might have been a little earlier, but the House Ways and Means Committee is having a hearing on paid family leave. And that is one of the things the U.S., compared to other countries, we're the only country that in the developed nations that doesn't have paid family leave. Some states have started to do it. California has it. DC, I think we're up to 9 states now that have paid family leave, but we don't have a national paid family leave. So again, women are having to take time off out of the workforce to care for their aging relatives, their children, others that need that support, which impacts their financial health, because often they might lose their job if they don't show up for work, if they're not available. So these options of giving people those that leave is critically important, and something that I really do support, and our alliance supports. One, I think, there are resources for caregivers that they often don't know about too. So, as I mentioned, the Alzheimer's Association has a lot of resources if you're someone taking care of someone with dementia to help you. There are government funded programs that do that. The National Institute on Aging has some great resources. They have a new website called alzheimers.gov that just has many, many resources. Some of it, how to work best with your loved one, ways to control angry outbursts. Or, someone was telling me a story yesterday about their mother is fearful of taking showers. So taking a shower, it becomes this really stressful event. And, they came up with some tools to put a stool in the shower and to put on the radio so there's music and other things that can help with that, so it's not this traumatic event. And some of those things can make a huge difference in your life, and just in terms of your stress levels, as you said, which, caregivers also, they're under a lot of stress, which impacts their health. So I think, taking advantage of some of these resources, really looking at, again, in the Alzheimer's space, one of my favorite things is a concept called memory cafes, which, really started, it's really going strong in the state of Massachusetts, and they have a lot of great resources to help. But I started one in my church just
What are
because.
they?
So memory cafes are places where people living with dementia and their care partners can go that's safe. And it's generally a social outing. COVID has certainly in that, but it's usually something fun. So when, people get diagnosed with dementia, other people feel awkward around them. So often, they don't get invited to dinner parties anymore. And so that creates social isolation and loneliness of not only the person living with dementia, but the spouse as well, or any caregivers. And these memory cafes And they're often sponsored by churches or local community centers, and just places where they'll have art classes or dancing. And I remember talking to a gentleman in Wisconsin who, it was such a lifesaver for him. He was caring for his wife. He would drive everywhere in the state of Wisconsin to any memory cafe because he found them to be so helpful, because it becomes a support network too for people
Absolutely.
who are going through the same thing you're going through, and can give you tips, but just also that friendship that you need, that makes you not feel like you're all alone in this journey.
Such helpful information and advice. As we wrap this up, Nora, if you had to give a prescription for financial wellness, if you what are your top tips, things that people should start doing today in order to be more financially healthy tomorrow?
Well, as I mentioned, if your employer offers a retirement plan, then you should participate. This is tax free. You save some on your taxes, and it's saved, and they usually make it automatic. It's easy. If your employer gives you a match, you should definitely take the match. Save up to that match, if not more. And there are many different vehicles. These deferred annuities are things that you can save for and have in place so that you can feel more secure about your retirement and your life income. As I mentioned, there are things you can do to automatically increase. One thing I didn't know when I was younger was that really, as I reached each decade, early in my career, I knew about the importance of match, but I didn't know I should be increasing how much I'm saving each decade. And it wasn't until I was in my 50s that I really figured that out. But luckily, the IRS lets us catch up when
Yep,
we
they
turn
do.
50. And there are these abilities to do that. So I just really encourage people to save as much as they can, and to look at your long-term care expenses as something there. Long-term care insurance is an option, but there are other new vehicles coming on right now. There are many savings, as I said, life insurance policies that can change. To talk to someone and look up again at protected income of really what are some of the options that you have to have a more secure retirement.
Yeah, absolutely. I would say amen to everything that you just said. Courtney said, what if they don't offer a match, contribute to an IRA instead? The advantages, Courtney, to a 401k are that you can put more money into it. So if you have the ability to do a 401k through work, if you like the investment options, it's also automatic, which means you can just turn it on and the money will go and you don't have to think about it. And I think that's the big advantage. I would also just add to what Nora said, if you need help, have a conversation with a financial advisor, ask some questions just to get yourself on the right road, on the right track. And Nora, thank you so much for all of this information and all of this advice. Tell us one more time where we go to find your research.
Sure. Just go to www.milkeninstitute.org. And our research is under the Center for the Future of Aging, but really we have a good search engine. And if you type in any of the issues that we talked about, our latest research should come up there. So, I really enjoyed this conversation, and thank you so much for the invitation to be here.
Absolutely. And for everybody who's watching, thank you for joining us. Thank you to the Alliance for Lifetime Income for your sponsorship. And if you're looking for more information, you can find it at protectedincome.org. We'll see you next time.